Hello, I'm Dr. Nick, the Incrementalist, and here today to talk about blunders and wonders. This week's blunder: open access to your medical record. A recent study published in the Journal of the American Medical Association looked at the US hospitals' compliance with the regulations for patients' requests for access to their own medical records, and it made for some pretty sobering reading. Dating back to 1996, patients have had the right to their medical record in the format they requested, assuming the records are reproducible in that requested format, at a reasonable cost. In fact, this one requirement is at the foundation of the walking gallery movement created by Regina Holiday and her 73-cent mural. That was the price Regina was charged per page for copies of her late husband's medical records. That was 2009, almost 10 years ago, and yet this study, we find that hospitals are not meeting the mandated release timeframes, formats, charges, and availability of medical records. Cost for release of a 200-page record ranged from $0 to $540. In an interesting twist, for those hospitals still stuck on limiting access to patients' laboratory results, some patients proceed directly to medical records for the release from the phlebotomy lab to request the release of the results, frustrated with hospital policy that either prevents or delays the release directly to patients. As Leonard Kish famously said back in 2012, patient engagement is the blockbuster drug of the century. If you could bottle it up and sell it, people will be falling over themselves to buy it. But engagement does not come in a data opaque or data missing scenario. So get with the federally mandated program and make the release of records and results an economic and experience easy process. This week's wonder: gene editing of the mosquito genes to eliminate malaria. Malaria is a killer. A big one that's killing almost 500,000 people a year. And it's not just malaria. Mosquitoes carry yellow fever, dengue fever, West Nile virus, alongside Zika, that caused major concerns across several countries in the last year or so. The latest test of a CRISPR gene editing tool published in Nature Biotechnology featured a novel gene drive that spread specific genes through a population over several generations. Tests were conducted in a closed experimental laboratory setup, so no release into the wild, and targeted gender determination, basically stopping females from being produced after 8 generations. This essentially crashed the mosquito population, and unlike previous attempts, no resistance was developed to the gene therapy. Next stop is a larger, more lifelike test, mimicking tropical conditions and looking at the impact on the food webs and predators. Assuming continued success, this could be a major breakthrough on the road to suppressing malaria and other mosquito-borne illnesses, but that might not be for another 5 or 10 years. Why so long? Well, although many of you might not be big fans of mosquitoes, they're an integral part of our ecosystem, providing an essential food source for fish, other insects and birds. They even pollinate plants. The unintended consequence of eradication might have a severe or catastrophic impact on our world, as we've seen with other well-intentioned human manipulations of the ecosystem, like the introduction of the toad and kudzu and the wolf snail. So there's hope on eliminating a major killer, but more work needs to be done. Until next time, I'm Dr. Nick, the Incrementalist. Don't let perfection stand in the way of progress.